Why is it so hard for the Republicans to repeal Obamacare? They've been talking about it for, I think it's 8 years now.
Well, the president signed the law in March of 2010, and I think what we found is that once benefits started to kick in, once people understood that they actually had the security of health insurance, many for the first time ever, or parents with kids with pre-existing conditions could rely on the fact that their children would have coverage, it's very difficult to take away. Definitely some help is needed. Definitely some attention to price, to choice, to competition is urgently needed. So I'm hoping that's where they go next, is actually listening to Chairman Alexander, Republican, Tennessee, former governor, working with Senator Patty Murray from Washington State. They've been holding hearings, talking to governors, talking to insurance commissioners, insurers, and they are coming up with a package of proposals that actually stabilize the market and help it become more competitive. And I think that's a really important step.
Well, Madam Secretary, as you say, it's hard to take those benefits away once they've been extended. Is there a risk that some of them will come away without legislation in the form of those subsidies for health insurance? My understanding is those may be in jeopardy.
Well, again, the administration has a lot of tools in their toolkit to really sabotage the law. So even if the Republican Congress fails to change the law, the administration has to make a choice of whether or not they're going to follow the law or ignore it. So far, they've actually ignored it. And I think they have sent very difficult signals to insurance companies. You talk about the subsidies. That's about $7 billion a year. The law requires insurance companies to sell policy to someone lower income that has less copay, less deductible, and then get reimbursed at the end of that year. The administration won't tell the insurance companies whether they're going to be reimbursed or not. So you see rates actually being raised, anticipating that they won't be reimbursed. That just hurts consumers. If the administration would make it clear, as Chairman Alexander and Patty Murray are saying, that the subsidies absolutely will be paid, guarantee that they'll go forward, I think you would see rates come down very quickly across the country before open enrollment starts.